If you have had cancer surgery, you may be familiar with the potential long-term symptoms that can affect comfort, function, and quality of life, ranging from minimal to severe. Many of the symptoms can be precipitated by scar tissue, and that's what we're talking about today in the Recovery Room podcast, episode 13. The pain and tightness, dealing with scar tissue after cancer surgery. Regardless of whether you have or had a stage 0, 1, 2, 3, or 4 cancer, we want you to be living as strongly, confidently, and as pain-free as possible. And regardless if you have 3 weeks, 30 months, or 30 plus years to live, you deserve to be pain-free and as fully functional as possible. I want to know if and how you have been affected by cancer surgery or scar tissue. So please leave us your comments and or leave us a voicemail at 414-373-0700. I am joined today by cancer survivor and podcaster Christina Miner. Christina is the host of the Our Scars Speak podcast. We will discuss internal scar tissue, external scar tissue, what it is, why it is, and how it can impact you, and ultimately how you can make it go away. Whether you are podcast watching or listening, I am so glad to have you here, and I appreciate you being here. I'm cancer physical therapist, Dr. Leslie Waltke. Please hang out until after the show to learn how you and I can engage directly in my incredible cancer survivor membership group called Recovery Room Plus. This is the Recovery Room podcast discussing all things cancer and cancer recovery. We will bring you the experts, accuracy, understanding, and next steps you need to be healthier, more confident, make better decisions, and live your best life after cancer. Christina Miner, welcome to the Recovery Room podcast. So awesome to have you here.
Thank you. I'm glad to be here. It's an honor.
So what I want to do next is talk about scar tissue.
Yeah, scar tissue is, well, I've had my challenges with scar tissue. And I think in my situation, because I had so much scar tissue and it was during COVID when I had my operation. So it was the physical therapist didn't touch me as much as I found out that possibly should have been touched, as far as like rubbing, and I'm sure you can explain in detail, but as far as like breaking up, I guess some people say the scar tissue, it was more hands off. It was hands on for a little bit, then it was hands off, and I had to kind of like really rehab myself with her there, but not so much hands on. And that was so my situation was a little different because of the time which we were in as far as COVID.
Yep.
But I did eventually go back, and I kept on going back. I went back for a very long time because I realized that I was very, very tight. Now, considering that I have hypertension, anything tight around my heart, I'm thinking, oh my God, am I having a heart attack? So I've had a lot of cardio tests done because of that, because I couldn't differentiate scar tissue, the tightness of it, on pressure in my lungs, whether I had, even because it was during COVID. Am I having COVID right now? Is it COVID affecting my lungs, or is it a heart attack? Or then I would, it was very difficult for us my body expanding naturally like it used to. So I was getting confused.
Yep.
And those are some of the things that I really, really battled with. And a lot of us really battle with when it comes to scar tissue. And then just the mobility part, at first it was very difficult for me. I still can't really go backwards too well, but I've come a long way. However, a lot of people don't even know the fact that maybe that's not normal, that you should be raising your arm a little bit higher. So those are the issues that I've definitely encountered with an excessive amount of scar tissue.
Yeah. There are people that will go through major surgeries. They get up and walk out of the hospital, never take a pill, never have an issue.
Right.
That is totally normal. Happens all the time. We don't hear those people yakking on Facebook,
Right.
because everything has gone well for them, but they're out there, and that's a very normal scenario. There's also people that everything goes wrong. I mean, something that 0.001% happens to 0.001% of the population. And if you just pull that lucky straw, blood clots, something happens to the lung in surgery. I mean, just infections, they can happen, and things just are a train wreck. That happens. happens. Okay. But most people fall in the middle. Okay. The majority of people fall in the middle where they do come home with a little bit of pain, a little bit of tightness, a little bit of weakness. And I will say those symptoms are typical,
Okay.
but that doesn't mean they're normal and they should
Right.
go away. So I'm going to say this again. Pain, weakness, and tightness after most cancer surgeries is typical, but it's not normal. All right.
Right.
And again, just sitting around waiting for them to go away doesn't always work.
Mm-mm.
Okay. If somebody has a stroke, they don't just sit on the couch and wait to get better. Okay.
Right.
Somebody has brain surgery, they don't sit on the couch and wait to get. Somebody's in a massive car accident, they just don't sit around and wait to get
That's
better.
right.
But for some reason, I just think that post-cancer surgery, it's not, it doesn't fall into that typical, okay, I've had surgery, I need to go to physical therapy, where we really need to make sure that we are getting people into that mode. So it's like if somebody comes and sprays your car with spray paint and just letting it sit there and expecting it to go away. All right. That's kind of the way scar tissue is. There's both external scar tissue, which is the one that you can actually see if you have an
Right.
incision. And if you've had surgery, you're going to have some of these babies are really, really small,
Yes.
and some of them are really big. And that is external scar tissue. And again, the magnificent body's way of closing a wound.
Mm-hmm.
So
Mm-hmm.
scars, people don't have to like them. They don't have to be proud of them, but you shouldn't be ashamed of them because
Right.
it is the human body is just magnificent. And to see it close an open wound like that by itself without you having to say,
Yes.
"Oh, lay here and concentrate on closing my wound." It just does it. It just does it. And it's phenomenal. So scars are amazing, but they should be fully mobile and they shouldn't hurt you. And if
Right.
you are having body image issues or issues of self-esteem or self-worth or self-identity or sexual identity, then gosh darn it, you deserve to talk to somebody to get that addressed
Yes.
because that's not normally, it's again, not abnormal, but it's not okay. You want to
Right.
get that addressed. So if you are stuck, please find somebody to talk to.
Mm-hmm.
And because that is not okay. And we can also make that better.
That
So
and
yeah.
then so
So what you're talking about is what our next conversation piece is that's going to be internal scar tissue.
okay.
All right. So we talked about the external one, where the one you can actually physically see that closes the wound. All right.
Okay.
So to be very, very kindergarten level of basic understanding of
Mm-hmm.
scar tissue is it is a normal process. Okay.
Right.
We all have scar tissue all over our bodies on the inside. We just don't even know that it's there because it's not bothering us. You only know if
Right.
it's there unless it bothers you. All right. So it's a normal physiological process that you can't control, I can't control, medication can't control, physician can't control. It just happens, like the scar that closes on your body. All right.
Right.
So in like deep abdominal surgeries, lung surgeries, most of the time that scar tissue will close stuff and develop and nobody knows it's there. Okay.
Mm.
But there are some surgeries that are a little closer to the skin. The chest wall is a perfect example of how scar tissue can cause two separate problems. Okay. Number one is skin mobility. Does the skin move normally? Okay.
Mhm.
And number two is skin or soft tissue length. And when I talk about soft tissue, I'm talking about skin, connective tissue, and muscle, all that stuff
Right.
that's in there. Okay. So let's first talk about soft tissue mobility. So skin should expand, it should compress, it should bend and twist, and it should be able to move in all different directions. If you put your hand on your skin, it should move, right?
Right.
And what happens with, again, a very basic description is when you remove tissue from the body or a surgeon removes tissue of the body, there's now a hole there. Okay.
Mhm.
Or there's typically two pieces of tissue now that are touching each other that didn't used to touch each other. Okay.
Okay.
So in the case of the chest wall, you normally have skin, then you have spongy breast tissue layer, then you have fascia and then muscle. Okay.
Mhm.
In the case of breast surgery, they remove the breast tissue. So now you have skin laying directly on top of muscle. Right.
Right.
And those layers can stick. So all of a sudden you're like, okay, this isn't compressing. It's not moving. It's not bending. It's not turning. It's not twisting.
Mhm.
And that can do two things. It can cause discomfort and it can limit your ability to get your arm over your head. Okay. Or your thigh. I've seen again this at the groin for melanoma surgeries is another huge time we see this. But the joint in that area may not be able to move fully. The joint is totally fine. Hip is fine. Shoulder's fine.
Mhm.
But you've been shrink wrapped. It just doesn't, the skin doesn't move over this. It's stuck to the stuff underneath. All right. And then so number 2 is soft tissue length.
Mm.
So often in cancer surgery, the surgeon is taking out stuff and then closing, right? To close, especially the chest wall, they sometimes will take out extra skin. So they're not leaving a dangle there because it doesn't need to be there. So obviously another part of surgery is, yes, they want to get the cancer out, but most surgeons will be very in tune with, okay, what is this going to look like to the person when I'm done with it?
Right.
So cosmesis is important. And again, you should have no
Absolutely.
worries about asking your surgeon, like, where's the scar going to be? How bad's it going to look? And is it going to be hidden under my shorts or my shirt? Or I would certainly encourage people to ask that question without being vain about it.
Right.
So there are times when the length of the soft tissue is now decreased. So again, shoulder's fine, spine is fine, rib cage is fine, hip is fine, but there's just literally not enough skin or connective tissue to elongate enough to either get your leg behind you when you walk or to get your arm over your head.
Wow.
All right. So when you visit a physical therapist, they will look at your skin mobility and soft tissue mobility. They will look at your tissue length. And then for how do we treat issues of tissue mobility, that's when you get your hands on and you got to mobilize that stuff. Okay. And yes, you can have both of them. Yes, you can have one or the other that are impaired. And sometimes, like I said, I see everybody post-surgically, and I will say at least 50% of them, you look great, get out. Do this walking program. We'll talk about long-term stretching.
Right.
But most people don't have issues, okay? Which is why surgeons will often say, my patients don't have any problems. You hear that all the time. Number one, most of them don't. But number two, they're only seeing people for, 3 months at the most. And they don't follow up with your surgeons anymore. And usually these problems happen down the road, okay?
Yep.
So this internal scar tissue, I equate to slow-setting cement.
Yes.
All right? You pour your sidewalk, and you can't walk on it for a while because it's still wet and it's still forming.
Right.
Scar tissue maturation can literally take a year and a half, typically, for most people.
Okay.
All right. And again, you're not seeing it happen. You're not feeling it happen.
Right.
You don't just wake up one day and not be able to move. It's just a very slow process. So people may be absolutely fine post-surgery, range of motion, they're moving, they feel great, but a year and a half later, they're reaching for something or they're stretching something in their back or their hip, and they're like, wow, that's tight. And they may not connect it with that is scar tissue issues from my surgery. So it's usually that year and a half after the surgery that I call the shrink zone.
Okay.
Where things just kind of slowly tighten, shrink. And again, doesn't happens to everybody, but there's some people, they get to their year and a half and they are totally fine. Other people are a train wreck. Most people are in the middle. So post-surgically, then you want to get your tissue mobility back to normal. You want to get your length back to normal. So the mobility we do with, hands-on soft tissue work, the length is going to be stretching. Okay. Your physical therapist can do that for you, but you're going to have to do it as well at home. All right. Because you just have to pull on it and hold until finally you just keep doing that. And eventually it's going to go, oh, I need to be longer. And then the body will start actually adding on sarcomeres to that tissue and make that tissue longer. Right. And then once you regain full mobility in your soft tissue and full length in your soft tissues, which usually can happen within anywhere from 2 to 6 weeks, depending on how severe it is post-surgically. But then the key is you got to keep it there. If you're still in that shrink zone, because it's going to just kind of keep doing this. So you've got to do this, and it's going to do this, and you're going to do that. And it's going to be frustrating for people because they're like, oh my God, I stretch and I feel so good. And I'm like, oh, I'm finally free. And then 2 days later, they're like, oh, I'm so tight.
It's like immediate, like you stretch out and it's like, oh, I feel great. And some people think, oh, okay, tomorrow I'm not going to stretch. And I'm like, no, you have to keep going.
So eventually you're going to win the war, but it's going to be beyond that shrink zone, which again, for the average person is a year and a half. Some people, it can go longer. I've seen people have to stretch for 3 years. Eventually you're going to win the war. It'll stop doing that. But during that zone, you may need to stretch once a week, once a month, or just check it, Because again, we don't normally go through typical, even if you're in yoga, there's some things that the scar tissue may impact you that you typically don't do on a
Mhm.
daily basis or even with exercise. So your therapist will give you ways to check that. Just make sure, oh yeah, you know what? Oh, feels fine. Don't need to stretch. Next month, check it. Feels fine. Don't need to stretch. Next month, oh, that's a little tight. I'm going to stretch a couple times. And again, typically that does not require a visit back to your physical therapist as long as you get your stretches out of the drawer, you go back to them. But that's where it is so important to regain normal tissue mobility,
Right.
regain normal tissue length, and then make sure you maintain it during the shrink zone, and
Mhm.
then you're good to go. So you're always going to need to do strengthening exercises for the rest of your life because you're human and you're
Right.
alive. You're
Right.
always going to have to do aerobic exercise because you're human and you're alive. And if you're a
Mhm.
cancer survivor, it's even more important for you to do that.
Absolutely.
But stretching exercises for your post-surgical site, you shouldn't have to do more than beyond a year and a half. Another thing I want to say is that scar tissue, because if you don't fix it and it bothers you and you notice it, it limits your mobility or it hurts you, that will pain and limitation will be there on your 95th birthday unless you fix it. It does not go away. It's not medically dangerous. Okay.
Right.
It's not going to ruin your life, but it is going to be, you hear it over and over again. It's there. It's not really that bad. It just, but again, it's a reminder that you had cancer. It is a
Yeah.
limitation. It's an irritation. And most of the time it's going to be that. But again, why live with that when you don't have to?
Right.
There are times when just subtle changes in the way your hip moves can affect your
Mhm.
spine over 10, 20, 30 years. There's subtle changes if you move your shoulder just forward a little bit. It increases pressure on your rotator cuff. If you have tightness in your groin or in your axilla or in your chest wall, it can put increased pressure on the
Mhm.
lymphatic system, which it doesn't need. So there's lots of reasons.
Right.
First of all, you deserve to be 100% when the potential is there. So there's a lot of reasons to make sure that you are stretching this stuff out. And again, some medical teams are very, very good about ushering you immediately into physical
Right.
therapy, and other teams don't. Your cancer's out, your margins are clean, you're
Yep.
healed. See ya. Okay. Again, doesn't mean that they don't care. It just
Right.
is not on their list. And I
That's
will equate that to I'm a physical therapist, and I'm a very good physical therapist, and I'm a very caring person. But I have never in 10,000 patients in 30 years asked my patients about their molars.
Right. Exactly. Because that's not what you're concerned.
That's not what I do. And it's not that I don't care. I'm like,
Right. It's just not your
I have,
area.
30 minutes with you and it's going to cost you $500
Right.
and I have to get all of this stuff done. I'm not going to take 5 minutes and ask you about your molars or ask you how your muffler is because
Right.
it's not in my scope. So people have to remember these physicians are good people. I work with cancer people are the greatest cancer practitioners are some of the greatest people on the planet.
Mhm.
They have a scope and they have got 15 minutes, 5 minutes, whatever it is. Boom, boom, boom. Doesn't mean that they
Yeah.
don't care. So you may have to say, hey, I need to go to physical therapy or I want to go to physical. And they can't tell you no.
Right.
Um, if they say I'm not going to give you a prescription, then you have 15 different physicians if you have cancer
Yeah.
typically.
You-
So find somebody that will give you a prescription. Because again, the only way you're going to know if you need PT and how much is if you are examined by a physical therapist.
I have, well, not really a question, but can you definitely explain that this is something that everyone needs to hear, and from you, it'd be very great. A lot of patients think that, oh, I've had this for 5, 6 years. I haven't gone to PT. I can't go now. And they
Thank
think
you.
that
That's a great
it's too
question.
late. Is
Yep.
that true?
No, you can
Okay.
anytime it's going to get better. There is no statute of limitations on improving scar tissue length and mobility. Okay, because what we're doing is so if it has been 5 years, 10 years, and I don't see that anymore. I did
Right.
when I first started because nobody got PT back in the 40s, 50s, 60s, and 70s, and 80s and 90s. Nobody did. So everybody that came in, those people would come in, they've been in pain for 20 years. So that was common. And you get
Right.
people off the table and they're just like, um, oh my God, this feels so good. So you can still fix it. Okay.
Okay.
So you can always make something stronger. You can always make something longer and you can always loosen stuff up.
Okay.
Right. And even at that point, there's a good chance that you can get rid of all of it or most of it. May take a little bit longer, but there is a good probability that you can get rid of nearly all of that.
Thank you.
So
Because a lot of
there's
people
no,
think they
yeah,
have to go back to surgery and start all over again, and because it's been too long. So
yeah.
thank you for explaining.
Yeah. Rarely can, it's again, like I said, on your 95th birthday, it's going to be there.
Right.
And again, what we're doing is we're not, the body doesn't reabsorb scar tissue. Okay. But what's happening, if you are having pain or limitation, it means it's stuck to something and not allowing you to move your tissues to move normally. So that's going to cause limitation. It can cause decreased use of the limb. So it's going to get weaker, and it can cause range of motion problems. But what we're doing is by lengthening and softening that it's still there, but it's not going to, it's not stuck to stuff. So you can all of a sudden start to move. And your symptoms are going to go way down, and your ability to move is going to go way up.
That's good.
It's really amazing that most people with cancer are going to have surgery. There are some cancers that are successfully treated and cured without surgery, but most people do. Okay. So for people who have stage 4 cancer or a stage 3 cancer where it is either is life-threatening or potentially could be life-threatening, it is incredibly important in that scenario to get people back to 100% as quickly as possible so they can live the time they have to the best of their ability, maximize quality of life, length of life, and get people back out on the tennis court or back out walking or taking care of themselves again or back home or whatever it is that you do that makes you you. But for people that have the stage 0, the stage 1, and the stage 2 cancers, it's still incredibly important that post-cancer surgery you get back, because your cancer's not going to kill you or very unlikely to kill you. And then why are you living with something like getting a crown on your tooth? It should be a one and a done and you move on. But people are having to live with just horrific pain and limitations because of a cancer surgery that is not going to be life-threatening. And then is there as a constant reminder, either psychologically or physically, that we can make go away for the most part. So it is really frustrating. So again, if you are living with long-term consequences of a surgery, start with your primary care physician if you've been out for a while, and find a physical therapist. And sometimes there are things that we can't fix because nerves have been moved, and sometimes in cancer surgeries they have to rearrange stuff.
Yes.
Your colon is different, your rectum is different, your lung is different, your brain is different. But most of the time we can improve or sometimes even eliminate a lot of these symptoms. So and keep the conversation going.
Absolutely. Definitely ask questions and, advocate for yourself 100% so that you can feel back like you used to, or at least close to it. I mean, because, you still may be on medications, but definitely speak up.
Yep, absolutely. Well, Christina Miner is the chief of the Our Scars Speak podcast. Again, a great title for this conversation.
Yes.
So again, her information is in the show notes. And Christina, it's always a pleasure to talk with you.
Absolutely.
So cheers, my friend.
Cheers.
All right. Thanks, everyone. We'll talk soon. Bye. Before we get to the recap, I want to remind you to leave your comments or leave us a voicemail at 414-373-0700. I also want to tell you again how much I love having you in my listener community. So if you haven't already, please follow and subscribe to The Recovery Room on both Facebook and YouTube, and to the Recovery Room podcast. Please share these wonderful free resources with your support groups, family, friends, and your medical teams. I also have an incredible cancer survivor community membership group called Recovery Room Plus. In Recovery Room Plus, you get direct interaction with me, in-depth cancer recovery info and experts, and really cool live events like yoga, book discussions, cooking demos, member meets, and much more. I would love to connect with you one-on-one. You can learn more at recoveryroomplus.com. The link is in the show notes. So to our recap for episode 13. If you are living with weakness, tightness, or pain around the area of your cancer surgery, even if it has been months or years, please get in touch with one of your cancer docs or primary care physicians to get you to a physical therapist to have the area looked at. Oftentimes, the symptoms can be lessened or eliminated. Remember, sitting around waiting for them to go away doesn't usually work. Remember, it's not okay to not be okay, and you are too important to not be 100%. You get one life and you get one body, so please treat them both well. I'm cancer physical therapist Dr. Leslie Walke, signing out from the Recovery Room podcast. Exercise like your life depends on it, and we will talk again soon.